All right, I think it's time for us to dive into this robust discussion of ours. As you all can imagine, this is a lively topic, very timely, now more than ever. We're going to focus on transitioning back to the school year successfully and ensure that you have the tips that you need as parents and educators to really allow your learners to thrive. We know there are a lot of extraneous factors that might be preventative, and we want to help you overcome those. And so today we have two panelists joining us. I am so pleased and grateful that they're here with us today. I will give a brief background of my history, and then I'll pass the mic to our two lovely presenters. I'm Jess Corinne. I'm the head of educational services for Learnfully. I started my career in education as a classroom teacher, and then I became a clinician, consultant, center director, regional manager for Mood Bell Learning Processes. And I spent over a decade refining the art of implementation with those multisensory evidence-based programs. And then I opened my own private practice where I consulted with a pediatrician's office, a few local schools, and provided direct services myself and my team of educational therapists. And that's what brought me to Learnfully. I am so excited to be here and to help oversee our programs, implementation, and all that's following. So I'd love to pass the mic to Sarah and hear a little bit about her background, and then we'll turn it over to Alicia. Go for it, Sarah.
Thank you, Jess. So my name is Sarah Levine. I'm a licensed marriage and family therapist. I work at Teen Therapy Center of Silicon Valley. I work in our in-home program, which as titled is a community-based in-home therapy and coaching program. We do a lot of individual work, but also family and parent support. I've worked with kids 0 to 18 my whole career. I really love working with kids and teenagers and their families. A really diverse background of clientele that I've worked with. I came from an agency that primarily worked with foster youth and juvenile probation. And so I, have a wide range of experience with different behaviors, but I really am passionate about kids who, have anger issues or oppositional, or maybe not everyone else's favorite client. Those are the ones that I really find fun to work with and have a lot of passion working with. So I'm super happy to be here. Thank you for Jess for inviting me, and I will pass it off to Alicia.
Hi, yeah, and I just want to let everybody know my voice is out just a little bit. I have a cold, so I'm sorry in advance. But I am Alicia Waldrop. I have been in education for a little over 10 years as a classroom teacher, an instructional coach, a professional development leader, a curriculum specialist. I've also worked with neurodiverse learners, both in a classroom setting and in one-on-one settings. I also have a passion for foster youth and working with foster kids, especially in a classroom setting and in my personal life. So this is something I'm also very, very passionate about, and I'm really excited to be here today.
Well, thank you both for joining us. We're excited to have you. Today's agenda is as follows. I'm going to give a brief overview in terms of Learnfully's mission and offerings, and then we'll dive into this dynamic discussion of ours about transitioning back to school and trying to ease the anxiety that may come from all of the jitters and when you get back to the school and resume back in the classroom. And then we'll have a little bit of Q&A at the end if we don't have time for that, because we do have so much information to cover and we want to provide you with immediate grabs. Then we will drop the questions in the chat, and we'll circle back with you to ensure you get the questions answered that you deserve. So no worries there. Still feel free to drop in the chat even if we're running low on time. So, overview of Learnfully, we are a highly curated network of educational specialists. Our educational specialists have experience in multisensory evidence-based programming and implementation both in classroom and personalized one-on-one settings. All of our educational specialists have a master's degree or above, and they have that charming personality to engage learners both in-line and in person, because we know that connectivity leads to the highest level of results. We focus on all areas of remediation, so literacy, math, writing, executive functioning, and social emotional health and wellness. We want to ensure that we are really looking at the foundation for how our learners learn, and then helping them to develop, strengthen, and apply those underlying sensory cognitive functions so that they can thrive, they can be successful, and they can feel confident in all aspects of their life, and not just in the classroom, but also outside of the classroom. With that, we ensure that we have a growing platform of content to ensure that we have the reinforcers that our learners need to continue their momentum and progress outside of our sessions. And we're also very clear on proactive communication channels and ensuring that our parents and our network of collaborators have all the information they need to ensure consistency is in place and that we're able to expedite progress so the learners can feel more successful and confident as quickly as is possible. So we are continuing to expand our network and, of course, welcome any and all inquiries thereof. Just a little bit of information about anxiety. As you all know, anxiety is at an all-time high, not just for our learners, but also for our caregivers, and understandably so. We're all still facing an unprecedented pandemic. We know that that has caused an uptick in anxiety, but to be completely transparent, learners can face anxiety without a formal diagnosis as well. We know that we have symptoms that we will discuss, and we have areas that we treat with or without the diagnosis. We want to ensure that our learners feel supported and bolstered as well. And so we found recently there was a study that there's 39% of teenage learners, 13 to 18, who are formally diagnosed. You can only imagine how high that number is actually, that some learners are undiagnosed, both with learning differences and with mental health challenges. And so we know that number is higher, especially amidst the pandemic. And so we will address that as part of our discussion today. So without further ado, I'm so excited to jump in and open up the floor for questions to our two panelists. First with Sarah, I'd love to hear your insight in terms of what are some of the general symptoms of anxiety that us parents and educators should take a look at.
Yeah, and thank you so much, Jess, for highlighting the fact that, anxiety in general is a, common experience that people have. And yes, absolutely, there's probably a wide range of learners and people out there who haven't been diagnosed or misdiagnosed, and there's parts of that we might be missing. So I appreciate that. And like I said, it's a very common experience and feeling. Everyone gets a little anxious at times, but it's when it starts to impair what we call daily functioning, meaning the anxiety you're feeling is actually getting in the way of you being able to accomplish kind of your daily tasks and routines. So you can imagine for a young person, that's likely going to school. That's kind of their biggest job at that moment. So when that feeling of anxiety impacts that, that's when it becomes more clinical. That's when it kind of crosses over. And so, as you mentioned, the symptoms I'm about to list are things that I'm sure everyone could riddle off a moment where they've felt these things before, but it's just whether it got to the point where it was so impactful that you couldn't perform certain tasks or achieve certain goals. So one of them, I think, is probably the most common one is feeling nervous or restless or tense, even like physically tense. That's a very common, response to anxiety. Having kind of a intense feeling of worry, a repetitive thought of concern, worry, or fear. And something that's a little less common that we actually do see in a lot of teenagers are physical symptoms of anxiety. So, increased heart rate, rapid breathing, sweating, trembling, but actually a major one we see in learners and young people is stomach aches. So, I would like people to think about those learners who go to the bathroom a lot or, are constantly complaining of stomach aches. It's really a common symptom in teenagers of anxiety. And I think a lot of people don't know that. Another one is having trouble concentrating or having a hard time thinking of anything other than the worry or concern. So it can mirror kind of that attention deficit stuff where they just can't seem to focus, but it's actually the worry that's getting in the way of their attention. Having trouble sleeping, again, really just up ruminating on things or overthinking, but also just having this urge to be awake and not being able to rest. And then there's just general avoidance of the trigger. So whether it's talking about the thing that makes you anxious, experiencing it, looking at it, whatever it might be, there's this desire to avoid getting triggered.
That's perfect. I know I faced the the avoidance type behaviors or symptoms, if you will. And I was sick often at school. It was always on a Monday. And so I can absolutely relate to that. My son has some of those symptoms as well, and he's transitioning back to school. So thank you for mentioning
Yeah.
those kind of psychosomatic symptoms as well. I'm
Yeah.
curious, like as this kind of segues into that, those are the common symptoms, some that are unnoticed, noticed more often than others. But how has the pandemic changed the game? You know, have you seen this uptick? How have you seen the anxiety rise in your learners?
Totally. Yeah. I mean, I think the pandemic has changed the game for everybody, whether it's, just generally worried more than we used to be, but for, school and our learners and our young people, I think they've gotten so used to, kids are incredibly resilient and adaptable, which is a
Mm-hmm.
great strength. But I think they got really used to that online platform and the comfort of their own home and the safety of their own home. And even some of the flexibility, I think, that educators and school professionals allowed for with COVID and the pandemic and the uncertainty. And now it feels like, okay, now we're going back to normal. And it feels abrupt. And, I know it's
Mm-hmm.
been for educators, they're like, oh no, we've been planning and talking about this forever. But for these kids, it feels like I did this for this amount of time and now I have to shift quickly to this. And so, there's parts of this online platform that, they might have, it feels like they forgot what regular school can be like, the regular kinds of passing periods and lunch, and whether that comes with peer pressure or social norms or just interaction with other kids. I mean,
Totally.
that's been missing from their lives, their school-based lives, for over a year now. And so the other thing I think that the pandemic has really heightened is their awareness of safety, health and
Mm-hmm.
safety. We've drilled into these kids, masks, social distance, don't hug people, don't touch people, don't do anything. And they're
Yeah.
balancing all of that while trying to learn now. So if they already struggled with just general learning, now they're in an environment where we're asking them to juggle quite a bit all at the same time. Keep an awareness of your body and your distance from others. Make sure your mask is on, wash your hands, also pay attention in class, also
Mm.
learn. That's a lot to ask of young people at this point. And, I think what I've noticed in kids is they can also sense just the general uncertainty from the adults in their lives, whether it's their actual parents or adult people, but also the media and the
Mm.
news. And there's just so much uncertainty going rampant through the world right now, and it's hard for them to not feel that. And so when we're saying, okay, gear up, you're going back to school, they're being hit with a lot of uncertainty. And so it's only natural that that would increase and heighten their worry about what's going
Absolutely.
to happen. So
I really appreciate you mentioning the need for us to kind of take perspective on that, because we're all sitting at home working right now, and we're not having to be in an office environment with many of our colleagues and peers with all of the layers of safety measures in place. And so it's so much more challenging, especially as we, kind of set them up for success and help them guide through some of these strategies to ensure that they feel supported and they feel like they're equipped, when in reality, I mean, we're not even having to face it ourselves as adults. So I would appreciate if you can walk through just a few simple strategies that parents can activate right away as an immediate grab, so they can feel they're supporting. And I would say of all ages. I know that anxiety is high in all ages, but a lot of
mhm.
our kind of transition to middle school and high school parents are feeling an extra layer of stress when it comes to
Yeah,
transitioning.
yeah, absolutely. So, I think that one of the first things that came to mind when thinking about these, this question is, you know, separating yourself from the anxiety is a tip that I personally use a lot in my practice with kids, which means you're you and the anxiety is something else. So even if that means having conversations with it and saying, no, that's not true, this is true, or, but also not being so consumed by what feels like the problem. So what we say is, you're not the problem is the problem. So it's not you, it's anxiety that we want to deal with. So that's a first step, is just normalizing for your kid and your young person that you have this external problem that we're going to deal with and you're not the problem. So I think that's a really big, important step. Anxiety is a lot of what ifs and I don't know, and all of this. So as many of those what ifs that you can actually get your young person to verbalize and then create plans for, meaning answer, well, what if this happens? Okay, well, let's think about that. If that happens, you will, or if that happens, we will, and create plans, because anxiety doesn't like plans. Anxiety doesn't like logic. It likes to fester in the uncertainty and the worry and the extreme. So if you start to create more logical plans, anxiety's volume gets turned down a little bit, because there's an answer to that big question. For those parents, with kids going into new schools for the first time, it's, what is the routine for this school? Have you driven there? Have you figured out kind of where to drop off your youth? Like, these are things that you can start to practice and think about now, especially if it's the first time your young person's going to be on that campus. You would be so surprised how much of where do I go is the big question. Where do I go when I get dropped off? What direction do I walk in? If your school has an online map on their website, looking at that. So starting to create some of those early school routines, I would say a week or more in advance. I know the school year is approaching. So what does it look like for your young person to get up in the morning and, get ready? And are they bringing lunch? Are they not bringing lunch? Like, these are all the things you have to start to work through. But routines really ground young people in structure. I know what's coming. I can expect this. This is another thing anxiety does not like, is for there to be expectancy of this, then this, then this. And then I think, again, in those moments where you're sensing people are anxious or worried, it's kind of those classic, let's take a deep breath. Let's talk about some of those grounding kind of logical things. There's wonderful apps and things for meditation for young people. So all of those things might be things to start looking into now. All these kids are wearing their AirPods as they walk around school. Who knows who's meditating on those things, right? We don't know.
That's awesome. Yeah, that's a great point.
Bring it with you. Bring all that grounding and mindfulness with you if that works for you. But I
love
think
it.
more than anything is talking about it. I think there's so much, even your own anxiety as a caregiver or a parent, talk about it, normalize it, lift the curtain, let your young person know that this is a shared experience. And when we talk about it, we take power from it. And I think it's just, again, let's plan, let's talk about it, and let's challenge the anxious thoughts, because often they're a little irrational, right? So we can create, new narratives for that. And I think we can't do that if we don't talk about it.
Yeah, I love that. You just gave me chills. It's so true. Normalize it. As a parent, you're often told, like, just bring it up at the dinner table, show and validate that you have anxieties and you overcome struggles, and, reinforce some of the coping strategies that you have in place as a parent, so they can feel like it is normal. So I'm so grateful that you brought that up, because I love the idea of having the Calm app in your, in your earbud. That's great.
Yeah.
All right, so we're going to go into kind of, how do you formulate a plan? Alicia, I'm going to start with you. How do you, like, as a practitioner, how do you formulate a plan when you know your learner is facing some of these anxieties, these stressors? How do you help them manage and cope through it?
Yeah, so this really just depends on the learner and what the underlying causes for anxiety really are. So I want to make individualized plans that target what they need first, while pulling from, this toolkit of things that we can use. But for example, I mean, I've had both adolescent and very young learners that have exhibited avoidance or refusal during instruction.
Mm-hmm.
So they're, and those show things in different ways. So, with a young learner, it may look like I'm giving instructions and she wants to immediately change the conversation, show a toy, and start talking about something different. And it really is just due to this underlying fear of either shame or embarrassment that's tied to maybe a learning disorder or something that may be even undiagnosed. And in an adolescent, it may be the same thing, but it shows a lot different in a classroom. So in a classroom with, a high school student, it may look a little bit more like asking to go to the bathroom constantly, or asking to go to the nurse, or avoiding eye contact with the teacher when we're about to get ready to ask a question. So while they have, similar underlying causes, they need different plans that are individualized for them.
Mm-hmm.
For those specific learners, we're looking at more building confidence. We're looking at making sure that they feel like they are in a safe environment before anything else, that it's a place where they're comfortable, they're safe, they feel like it's okay for them to make mistakes,
Mhm.
and we're really focusing on that positive reinforcement of when they do make mistakes. We're praising the process. We're focusing on, okay, you are brave and ask this question instead of avoiding it or running away from it or, bringing up a different topic. So from an education, perspective, from a teacher's perspective, it's really focusing on what they need. So for those particular learners, that might be an approach. But overall, we're working on self-awareness. We're working on
Mhm.
building confidence, teaching self-awareness so that they're able to just recognize, okay, I'm trying to avoid this situation right now. How can I stay and use the skills that I've been learning to work through this problem or
Mm.
face this challenge or this change? And another thing is just like what she mentioned with mindfulness. They actually have it reminded me, they have awesome subscriptions for students and for teachers right now that if you're using, I believe it's Calm in the Classroom, they give free subscriptions for you to use that with your students and in your classroom as brain breaks, giving them moments to sit and be present. And another thing is just practice facing challenges. So if we constantly have those little changes or those little challenges inside of the classroom, they're gaining a little bit of that exposure. And it's easier to form a plan with any of their caregivers, so that we can all be on the same page and really work towards that end goal of using those strategies.
I love that. I just had to practice my coping mechanisms to stop sharing and reshare. So thank you, ladies, for guiding me through that. I appreciate it. It's live in action. So as we go forward, we talk about all these amazing strategies that parents and caregivers can use. But I'd love to hear from both of you, and I'm happy to start with Alicia and then pass it back to Sarah. How do you really help them generalize it? Because it's important that they get this support in these individual environments, right? But we don't want this skill to be isolated to those environments. So how do you ensure that they're able to carry over their skills with this confidence and feelings of success outside of the classroom and outside of the home? So when they're facing other social anxieties or what have you, how do you help them generalize it with the community?
Yeah, so one of the things that when we're talking about generalization, I kind of focus on two different things. One is just the reciprocity of what's going on at, outside, all the factors that are affecting behavior outside of the classroom, and then the factors that are affecting behavior inside the classroom. So if we have something that's external, those behaviors are being generalized and then brought into the classroom in a way that teachers can see. So we're recognizing these behaviors, but that gives us like the power and the influence to instill these positive influences as well. We can impact them in a positive way by giving them the skills and practicing um, a lot of these techniques and concepts. And right now I'm talking about more of you know bigger concepts and skills like problem solving. And if we're able to influence that inside the classroom, they can then generalize that back into their personal lives and their community that's outside of the class. Um, but yeah, when we recognize this, we have to realize it's got to be a strategic plan. Like it's got to be something that we're really working together on, because if we're not working with caregivers, outside and inside, they can either be in conflict with each other or they can be in collaboration with each other. And that collaboration is what's going to really instill these skills to go beyond just that one classroom in that one time period. We're focusing on trying to have these problem solving skills become independent skills that they can do. And we're just kind of coaches that are on the sidelines helping them through it. And that's really the goal. The goal is for them to take the skills that they're learning at one time, use it in lots of different environments, have multiple people that are helping the learner, and also transcending time periods. They may use something that they're learning now, 10 years in the future, or in a different class the next year. So that's the first thing. The second thing I like to talk about is just very specific to lessons. So generalizing a specific academic standard, something that can be, an academic skill with reading or decoding or, analyzing literature. But if we're talking about something like reading, really just diversifying the way that you're teaching. recognizing that, okay, they've mastered the skill when I've presented it this way, but what happens if we change it up? What happens if I ask them to demonstrate their knowledge in a different way? For example, like phonemic isolation. If we're talking about, hey, here's a picture, what's the beginning letter of this word? And then once they get that mastery down, once they're able to do it without saying the word, sounding it out, but they can just kind of spit it back out at you, changing it to the end letter. Same skill, but you can notice, okay, it slows down for a second. They've got to rewire a little bit and demonstrate that knowledge in a different way. And I think that just constantly adding those variables helps them to generalize that understanding in a way that's a little bit stronger. They're able to demonstrate it better. And then we can also bring in their caregivers and have them reinforcing that same skill. You know,
I love that. Yeah.
making sure we're working with them, you know, they're practicing it with us and able to demonstrate it in both settings.
I love that you mentioned specific examples about academics too, where we are working on social emotional health. Of course, we're working on executive functioning as well. But this idea of making sure they can see success in all of their skills across all of their environments reduces the anxiety to take initiative, take risk, lean into discomfort, right? So I appreciate you saying it's not only the consistency, but the collaboration that's the key to success, for sure. Thank you, Alicia. Sarah, would you like to add anything to that, how you help them generalize?
Yeah, definitely. I think one of the things that as a therapist and a mental health provider, we coping skills is like the main jam, right? We're always looking for developing coping skills, but often what happens is they have a set of coping skills that only works in one environment. And so it really does a disservice to the youth if we're like, okay, great, you have your toolbox, that all your stuff at home, right? And so what it is finding ways to emulate the things that work, whether it's vice versa. Things that work at school, we figure out how to make them work at home. And it's getting creative. I think, the environment is incredibly different, but also there's still a caring adult person there, right? So leaning on the teachers and the staff at school to help kind of emulate some of the things that might be working at home and vice versa. If there's success in the classroom with coping, a lot of parents are like, they don't act like this at school. And it's because there's something at school that's working well. And so it's a lot of discovery and kind of investigative work to figure out what it is that's working and emulate that, because there usually is a transferable skill or a transferable something to the home and to the school, and vice versa. And so I think as a mental health provider, it's always broadening our scope. Even if you're working with the home and the family, it's saying, okay, but also how can we apply this to like the greater picture? Because it really doesn't, you're never working in isolation like that. And, I think Alicia said it well, is that you have to partner, you have to work. And that means just making sure everyone's bought in and using the same language. If we have a phrase that works to calm them down, everybody is saying that, it's a team approach. And I think that's the best thing that works with these young folks.
Absolutely. Fully agree. Sorry for my tech difficulties, but you're doing a brilliant job working through it. I'd love to hear, as we close, just one thing that you each would like for parents and educators to keep in mind at the beginning, in the middle, and the crux, and all the trenches of this journey. Just one quick tip or one thing that you would like for them to have in the back of their mind as they work through it. Sarah, if you want to start us off, that would be great.
Yeah, absolutely. I think I've said it already before, but this is something we all went through. I think even as a therapist, it's probably the first time in my career that I shared the trauma with the clients that I worked with. I mean, this was a globally shared trauma. I don't know that at any other point we could say that. And so I just ask parents and educators and adult people to think about that we went through a trauma as adults. And maybe as adults, we were able to quickly adapt and find new ways to cope, or we had ways to cope or resources or emotional bandwidth. And for some of our young people, this was the first major life challenge they've ever had to face. And it was a big one, a huge one. I mean, their whole worlds were changed, from everything from the sports they played to the clubs they were in to the friends they saw. Like all of that was just gone from one day to the next. And so the analogy I used throughout the whole year was like, we gave them the final exam, but gave them no time to study. And so I think that's hard because we as adults have lived life long enough to maybe have acquired adaptive or maladaptive coping skills of some form. And a lot of these kids didn't have that, and they're kind of trying to figure it out in the moment. So yeah, they might not be functioning at their best. And so I just ask for grace in that, because again, we all went through it, but they didn't have time to study for the test.
Yeah, that's
So
awesome.
it's hard.
I love that analogy. Yeah, it's extremely hard, but that's great for perspective taking. Absolutely. And for grounding all of us in that mindset.
Yeah.
So thank you for that closing thought.
Yeah.
Alicia, anything you would like as a closing thought that you would like parents and caregivers to keep in mind?
Yeah, I have one really quick one. The first one is just definitely share what you're comfortable sharing with your teacher, with your child's teacher. Please share if you know of symptoms or what to look for. It bypasses so much time and has the teacher and the caregivers on the same team much quicker and able to create intervention plans or address certain issues that arise a lot quicker than relying on just the educator to recognize the symptoms. It was very apparent in the past school year because we were mimicking a transition year from month to month or even week to week. So we were seeing a lot more of those symptoms, but definitely even with a more typical year, sharing what they know to be true, what they know works, because it does help the educator or other team members, so a nurse or interventionist, just address those issues a little bit quicker. And then the second thing would just be avoid something that I've noticed I've been doing, because I have a teenager that's about to go into college, is avoid sharing our own anxieties with them before they've even had a chance to have them. With my own daughter,
So hard.
like she has a whole thing of anxieties that she is worrying about, and then I'll catch myself adding to those. So instead of saying like, are you nervous about, making friends and having a whole new environment or new professors or the workload? It's like, no, I've got to stop. I've got to take a step back and ask, what are you excited about? And then focus on some of those positive things, because they're going to have their own anxieties and nervousness around peer relationships and new professor relationships and everything anyway. And the same thing at high school and middle school and elementary school. So.
Oh, that's huge. Trying not to project your anxiety, although it's so hard. It is, I think, one of the most challenging things as parents that I face is reframing the way I ask that question. So thank you so much for that reminder, because it's so true. I think a lot of us face that on a daily basis. I even was talking to my son, because my children are transferring schools this year, a new state, new school, new grade, new friends. And I was like, so are you nervous? Are you excited? Like, instead of saying even that, I should have said, so what are you excited about? So I catch myself too. And I appreciate you sharing that as your final thought. Well, I want to thank you all for joining us. I think this has been absolutely fantastic. I appreciate your grace as I dealt with my tech issues and was able to cope with my own anxiety. Both of you have brought so much brilliant insight to our community. I'm just so grateful that you were here to share your expertise, your love, your kindness. For any of those who didn't get their questions answered, I promise I'll reach out. Feel free to contact us by emailing us, calling us, text us, follow us on the social, whatever is your fancy. We just appreciate you being here and look forward to seeing you next time. Thank you all for joining us. Take care.